Checking in at a hospital reception.
Hi, I have an appointment at 3 p.m., but I'm here a bit early because I wasn't sure about traffic.
No worries, arriving early is always a good idea. Can I have your name, please?
James Carter. I'm here to see Dr. Lawson for a follow-up check.
Let me check. Yes, I see your name here. Have you been experiencing any new symptoms since your last visit?
Yes, actually. I've been feeling unusually tired and sometimes lightheaded.
Thank you for letting me know. The doctor will want to hear that.
Should I go straight in or wait here?
Please take a seat. The nurse will call your name soon.
My anxiety always spikes at hospitals. I can't seem to calm down.
That's completely normal. You're not alone. Many patients feel the same.
Really? I thought I was just overreacting.
Not at all. You're taking charge of your health, and that's something to be proud of.
Thank you. That actually makes me feel better.
You're welcome, James. If you need water or help, just come back to the desk.
I will. Thanks again for being so kind.
Describing symptoms to a doctor.
Doctor, I've had this constant headache for a week, and painkillers don't seem to help anymore.
I see. Is the pain sharp, dull, or throbbing?
It feels like pressure behind my eyes, especially at night.
Have you been sleeping well lately?
Not really. I wake up several times feeling anxious.
Stress can trigger headaches, but I'd like to rule out other causes.
Do you think it's something serious?
I don't want to guess without proper tests. Worrying won't help, but taking action will.
That makes sense.
I'll schedule a scan and some blood work.
I'm scared of what we might find.
Fear is normal, but information gives us power.
I never thought a headache could affect my life like this.
Your health is your foundation. Let's strengthen it together.
Thank you. I already feel less alone in this.
Pharmacy medication confusion.
I picked up this medication yesterday, but I don't understand how to take it. The label is confusing.
Let me take a look. Ah, yes. This one has a strict schedule.
I'm afraid I'll take it wrong and make my condition worse.
You won't. I'll explain it step by step.
Thank you. Nobody ever explains things this clearly.
Sadly, many people leave pharmacies unsure of what to do.
I thought it was just me.
Not at all. Your health matters. Asking questions is smart, not embarrassing.
I feel much better now.
Anytime. Come back if you forget anything.
Blood test anxiety.
I know this sounds silly, but I'm terrified of needles.
That's not silly at all. Lots of adults feel the same way.
My heart is racing just thinking about it.
Let's take it slowly. Breathe in through your nose, out through your mouth.
Okay. That helps a little.
The needle is very small, and I'll be gentle.
I just hate not feeling in control.
You are in control. You're choosing to face this for your health.
I never thought of it that way.
Ready? 1, 2, and it's done.
That was it?
Yes, sometimes fear is louder than reality.
Thank you for not laughing at me.
Healthcare isn't just medical, it's emotional too.
I'll remember that.
A parent concerned about their child.
My daughter has had a fever for 3 days, and I'm terrified something serious is wrong.
I can see how worried you are. Has she been eating or drinking normally?
No, she barely touches her food and keeps holding her stomach.
Fever plus stomach pain can mean a few things.
I keep thinking the worst.
That's normal for parents, but panic won't help us. Information will.
What do we do now?
I'll run some tests. Most childhood infections resolve with proper care.
I haven't slept in 2 nights.
You need rest too. A tired parent can't help a sick child.
You're right.
Let's take this one step at a time.
Thank you for understanding.
Your daughter is lucky to have someone who cares so much.
I just want her to smile again.
Asking about medical insurance.
I received this bill yesterday, and it says I owe more than $2,000. I thought my insurance covered everything.
Let me take a look. Sometimes insurance companies only cover part of a treatment unless it's pre-approved.
Nobody told me anything about pre-approval. How could I have known?
I completely understand how frustrating that feels. Medical billing can be confusing for anyone.
I already feel stressed about my health. And now I have to worry about money, too.
You shouldn't have to deal with that alone. Let's go through it together.
Does this mean I'm stuck paying all of it?
Not necessarily. In many cases, we can file an appeal and request reconsideration.
So there's still a chance the insurance will cover it?
Yes, especially if your doctor confirms the treatment was medically necessary.
Why isn't this information explained at the start?
Honestly, the system isn't patient-friendly, and that needs to change.
It feels like I'm being punished just for being sick.
I hear you. It shouldn't feel that way.
What should I do now?
I'll help you fill out the paperwork and contact your insurance company.
You'd really do that?
Of course. My job isn't just numbers. It's helping people breathe again.
Thank you. I feel lighter just knowing someone cares.
You're welcome. We'll get through this one step at a time.
Discussing mental health with a therapist.
I don't know what's wrong with me. I wake up tired, go to bed tired, and still feel like I didn't do enough.
That sounds exhausting. Like your mind never takes a break.
Exactly. It's like a voice keeps telling me I'm failing at everything.
And that voice feels louder than your real achievements, right?
Yes, and people say, just relax, but it doesn't work like that.
Because your battle isn't laziness, it's emotional overload.
So I'm not broken?
Not at all. You're overwhelmed, not defective.
I didn't expect you to say that.
Therapy isn't judgment, it's understanding.
How do I stop feeling this way?
By learning to recognize the voice in your head and choosing which thoughts deserve your energy.
That sounds possible.
Healing always begins with possibility.
For the first time in months, I don't feel completely hopeless.
That's progress, and we'll keep building on it, together.
Nutrition consultation after diagnosis.
Ever since I was diagnosed with high cholesterol, I feel like every meal is a trap, waiting to hurt me.
That's a common reaction. When food becomes fear, we lose joy.
I miss eating without overthinking every bite.
You don't have to give up enjoyment. You just need education, not restriction.
So I'm not banned from all my favorite foods?
Not at all. Balance is smarter than punishment.
That makes me feel so much better already.
Good. A healthy lifestyle should feel possible, not miserable.
Can we make a plan that fits my schedule? I work long hours.
Absolutely. Your diet must fit your life, not the other way around.
Thank you. I didn't expect this to be comforting.
Healthcare should always include comfort.
I feel hopeful again.
Hope is the first ingredient of change.
Let's start.
And we will, step by step.
Physical therapy after an injury.
Every step hurts, and I'm scared I'll never walk normally again.
Pain today doesn't predict your future. It's part of the healing path.
But what if my body never recovers?
Bodies heal more than we expect, especially when we give them a chance.
I feel weak and useless.
Strength doesn't start strong. It starts scared.
I never thought of it that way.
Every exercise you do is a victory, even the small ones.
It still hurts so much.
Pain is your body waking up, not shutting down.
Do you think I'll really walk properly again?
I believe it. The question is, do you?
I want to.
Wanting is the seed. We'll water it with effort.
Okay, let's try again.
That's courage speaking.
I guess I'm stronger than I thought.
You always were. You just needed proof.
Asking about medical test results.
I saw the lab results online and I don't understand half the words. It feels like the report is written in another language.
Medical reports often use terminology that's accurate but not human-friendly.
I Googled a few terms and now I'm convinced I'm dying by next month.
Google lists every possible outcome, not your specific case.
So, am I okay?
Your numbers are higher than ideal, but not dangerous. It's a warning, not a sentence.
I wish they taught this stuff in school.
Understanding your body should be basic education, not a mystery.
I feel like I can breathe again now.
That's the purpose of clarity, to give oxygen back to fear.
What happens next?
We make a plan and we stick to it.
Thank you. I was panicking for no reason.
You were panicking because you care. That matters.
I'm ready to do what I need to do.
And I'll be here for every step.
Difficulty breathing. Talking to a nurse.
I've been having trouble breathing since last night, like there's a weight on my chest.
Are you feeling short of breath right now, or does it come and go?
It's worse when I lie down. I had to sleep sitting up.
That must have been frightening. Do you have any history of asthma or allergies?
No, this is the first time something like this has ever happened.
I'll check your oxygen level to see how well you're breathing.
My hands are cold and shaking. Is that a bad sign?
It can be caused by anxiety or low oxygen. Don't panic, we're here now.
I hate not knowing what's wrong with me.
That's why you came. Answers replace fear.
I really hope so. I haven't felt like myself for days.
The doctor will be here shortly. You're not alone anymore.
Thank you for being calm when I can't be.
That's what we're trained for. Your breath matters to us.
I already feel a little safer being here.
Good. Healing begins where fear ends.
Hospital discharge instructions.
So, I'm finally going home today. I'm happy, but scared I'll do something wrong.
It's normal to feel nervous. Just follow your discharge instructions carefully.
There's so much information here. Medications, diet, what not to do.
We'll go through it together, step by step.
What if I forget something?
You can call us anytime. You're not leaving your support behind, just the building.
That's comforting. I thought once I left, I'd be on my own.
Healing is a journey, not a doorway.
So I need to avoid lifting anything heavy for 2 weeks?
Correct. Your body needs time to repair itself.
And these pills, 3 times a day, right?
Yes, with food so they don't upset your stomach.
I feel like a student again, trying to memorize everything.
Your only homework is to get better.
Thank you for not rushing me.
Your recovery deserves patience.
I guess going home doesn't mean it's over. It means it starts.
Exactly. And we're cheering for you all the way.
Requesting a second medical opinion.
I hope this doesn't offend you, but I'd like to get a second opinion about my diagnosis. That's absolutely your right. Good doctors welcome more information, not less. Really? I was afraid you'd think I don't trust you.
Wanting clarity isn't a lack of trust. It's self-care.
The diagnosis feels overwhelming. I need time to understand it.
That makes perfect sense. A second opinion may give you peace.
You're not angry?
Not at all. You're a human being, not a robot who obeys instructions.
That's a relief. I've been terrified of saying this.
Fear shouldn't stand between you and your health.
What do I need to do?
I'll prepare your medical records so you can take them with you.
Thank you for taking this so well.
My goal isn't to be right. It's to help you heal.
I already feel lighter.
That's what good decisions feel like.
Language barriers at a clinic.
I'm sorry, my English is not good and I don't understand this form.
That's okay. Let's fill it out together slowly.
I get nervous when people speak fast. My mind freezes.
You're doing great. Healthcare shouldn't be a test of language.
Thank you. I thought you would get annoyed.
Never. You deserve care, not pressure.
What does medical history mean?
It means illnesses or surgeries you had before.
Oh, now I understand.
See? You just needed time, not perfection.
I feel embarrassed sometimes.
No need. Everyone deserves health, no matter the language.
Thank you for being patient.
Patience is part of healthcare, not an extra.
I feel safer now.
That's the best medicine we offer.
A doctor giving difficult news.
The results are back, and I wish I had easier news to give.
Please just tell me. Waiting feels like torture.
You have a condition that will require long-term treatment.
So it's serious.
Yes, but not hopeless. Many people live full lives with this condition.
I feel numb. I don't even know how to react. Does this mean everything changes now?
Not everything, just how we take care of your health.
I thought I was fine. I don't feel sick.
Illness doesn't always announce itself loudly.
What happens now?
We make a plan, step by step, not all at once.
I'm scared, but your voice makes it less terrifying.
Fear doesn't mean weakness. It means you understand the weight of this.
Thank you for speaking to me like a person, not a file.
Your life isn't a file. Your life matters.
Asking about surgery risks.
I know surgery is the best option, but I can't stop thinking about what could go wrong.
Fear before surgery is normal. Your brain is trying to protect you.
Can people die from this procedure?
The risk exists, but it's extremely low.
Why does danger feel louder than safety?
Because fear shouts and reassurance whispers.
That's exactly how it feels.
I'm here to raise the volume of reassurance.
Will I wake up in pain?
There will be discomfort, but we manage it. You won't be alone.
What if something goes wrong during surgery?
A team is watching every heartbeat and breath. You're surrounded by expertise.
That makes me feel less helpless.
Surgery is a mountain, but we climb it together.
Okay, I think I'm ready.
Readiness doesn't mean no fear. It means choosing hope anyway.
A hospital visitor asking about ICU rules.
My father is in the ICU and I'm scared to touch anything. Why are there so many rules?
The ICU protects patients with fragile health. Even a small germ can be dangerous.
So, washing hands every time is really necessary?
Absolutely. Clean hands are sometimes stronger than medicine.
It feels strange not being able to hug him.
Your presence is a hug, even from a distance.
I don't want him to think I'm cold.
He knows you're here. Love doesn't need contact to be felt.
I never imagined hospitals were so emotional.
Healing happens in the body, but it begins in the heart.
Thank you for explaining.
You're not visiting rules. You're visiting someone you love.
Talking to a pharmacist about side effects.
I started this new medication yesterday and now I feel dizzy and nauseous. Is that normal?
Some medications cause side effects as your body adjusts.
Should I stop taking it?
Not without talking to your doctor. Stopping suddenly can be harmful.
I didn't expect medicine to make me feel worse.
Sometimes healing feels like breaking before rebuilding.
That's a poetic way to say it.
Healthcare isn't just science. It's human experience.
When will the dizziness stop?
Usually within a few days. If it continues, we'll look for alternatives.
So I'm not stuck feeling like this forever?
Absolutely not. Medication should help, not imprison.
Thank you for listening instead of brushing me off.
Every question deserves an answer.
Dental pain emergency.
My tooth hurts so badly I can't sleep, and the pain shoots through my whole jaw.
That sounds like an infection. When did it start?
2 days ago, but today it feels unbearable.
Pain is your body asking for help. Let's find the cause.
I'm scared the treatment will be worse than the pain.
Relief always feels better than fear.
Will you have to pull the tooth?
Maybe, but only if we can't save it.
I don't want to lose it.
Your smile matters. We'll protect it.
Thank you for being gentle.
Care without kindness isn't care at all.
I'm ready.
Let's fix this together.
Sleep disorder consultation.
I haven't slept properly in months. I lie in bed exhausted, but my brain just won't shut up.
Insomnia can turn nights into battles. You're not alone.
I feel like I'm failing at something everyone else does without thinking.
Sleep isn't a skill, it's a system. When it breaks, we repair it.
How do we start?
By understanding your habits, fears, and rhythms.
I'm afraid it'll never get better.
Fear is part of the story, not the ending.
You make it sound possible.
Healing always starts with possibility.
I want my nights back.
And we'll take them back. One breath, one routine at a time.
Discussing chronic pain.
I've been living with this back pain for almost 2 years, and sometimes it feels like my whole life revolves around trying to avoid hurting.
Chronic pain can affect every part of your day, not just your body. When is it at its worst?
Mornings are terrible. I wake up already exhausted because the pain never really stops.
Do you feel the pain more when you sit, stand, or move around?
Sitting is the worst. I avoid chairs now, which makes working almost impossible.
That must be incredibly frustrating, especially if it limits your independence.
It feels like my body has betrayed me. I used to run marathons.
Injuries and conditions can change our reality, but they don't erase our strength.
I'm scared this is my new normal.
It doesn't have to be. Pain can be managed with therapy, medication, or other treatments.
But nothing has worked so far.
That doesn't mean nothing will ever work. Sometimes it takes time to find the right combination.
I really want my life back.
And that desire is the first step. We'll build from there.
So you really believe there's hope?
If you're willing to try, I'm willing to fight alongside you. Asking about a family member's condition.
My brother was rushed in here an hour ago. No one has told me anything, and I'm terrified.
I understand how stressful this must feel. Let me check his status for you.
I keep imagining the worst. My mind won't stop.
Fear fills the silence when we don't have answers.
Exactly. I just need to know he's alive.
He is stable, and the doctors are running tests to understand what happened.
Stable? Does that mean he's okay?
It means he's not getting worse. That's a good sign.
I wish I could see him.
Once the doctors finish evaluating him, you'll be allowed to visit.
I feel useless just waiting here.
Waiting is part of caring, even when it feels powerless.
I didn't realize how much he means to me until now.
Moments like this reveal our hearts.
Thank you for not brushing me off.
Families deserve answers just as much as patients do.
Fear of a blood pressure diagnosis.
You said my blood pressure is high, but I don't feel sick at all. Isn't sickness supposed to hurt?
Some illnesses whisper before they scream. High blood pressure is one of those whispers.
So I'm a ticking time bomb without knowing it?
Not a bomb, just a system that needs attention.
Can I fix it without medication?
Lifestyle changes help, but medication ensures your heart isn't under constant strain.
I hate the idea of pills. It makes me feel old.
Taking care of yourself isn't aging, it's wisdom.
I never thought of it that way.
You're investing in your future health, not surrendering to age.
What happens if I ignore this?
You increase the risk of heart attack or stroke.
That's terrifying.
Fear can start change, but hope sustains it.
Okay, I'll take the pills.
That's a strong decision. Your heart will thank you.
Discussing sleep apnea.
My partner says I stop breathing at night, and sometimes she shakes me awake because she thinks I'm gone.
That sounds like sleep apnea. Your brain may not be receiving enough oxygen while you sleep.
It scares her, and honestly, it scares me too.
Fear is understandable. Your body is asking for help.
I thought snoring was harmless.
Snoring can be a symptom, not the cause.
Will I have to sleep with one of those machines?
A CPAP machine can help your breathing stay stable at night.
It sounds uncomfortable.
Uncomfortable is temporary. Oxygen is life.
You're right. I guess breathing beats pride.
Exactly. Sleep isn't rest without oxygen.
I want to stop scaring the person I love.
Then let's give both of you peaceful nights.
I didn't know sleep could be dangerous.
Sleep heals, unless the body forgets how.
Talking about a cancer screening.
My friend was diagnosed with cancer last year, and now I'm terrified it could happen to me.
Fear often pushes us to check what we've ignored. Screening is a smart choice.
What if the test finds something?
Then we act early. Early isn't scary, it's powerful.
I hate waiting for results.
Waiting stretches time, but it doesn't change truth.
Why does it feel like my whole future depends on a piece of paper?
Because we imagine endings before beginnings.
I don't want cancer to steal my life.
Screening isn't surrender, it's defense.
So taking this test means I'm fighting before the enemy arrives?
Exactly. You're preparing, not panicking.
I feel a little braver now.
Bravery is just fear that refuses to run.
Okay, let's do this.
And we'll face whatever comes, together.
Hospital roommate complaints.
I know this sounds petty, but my roommate keeps talking loudly on the phone, and I can't rest.
Rest isn't petty. It's part of healing. You deserve peace.
I feel guilty complaining.
Advocating for your needs isn't complaining. It's self-care.
I thought hospitals were quiet places.
They are, but people bring their lives with them.
Is it possible to change rooms?
If one is available, yes.
I don't want to cause trouble.
You're not causing trouble. You're protecting your recovery.
I didn't expect to feel so vulnerable here.
Illness opens emotions we don't realize we have.
Can you talk to her instead?
Absolutely. I'll explain gently.
Thank you for taking this seriously.
Every need matters, even the quiet ones.
Understanding a prescription change.
You changed my medication and I'm worried. The old one wasn't perfect, but it was familiar.
Familiar isn't always better. Your body needs something more effective.
Why now? What changed?
Your recent tests show the old medicine wasn't working anymore.
I hate starting over. It feels like losing progress.
Change isn't losing, it's redirecting.
What if this one has worse side effects?
Then we adjust again. Treatment is teamwork, not punishment.
I just want stability.
Stability comes from the right foundation, not the first one.
I suppose health is trial and error sometimes.
It's trial, error, and learning.
I'm willing to try if it means a better future.
That willingness is the strongest medicine we have.
I trust your judgment.
And I honor that trust with care.
Talking about a diet restriction.
I've been told I can't eat gluten anymore, and I feel like my entire lifestyle just collapsed.
Food habits are emotional, not just nutritional. Change feels like loss.
I miss bread. I miss comfort.
Comfort can be found in new places too.
Everyone else eats normally. I feel broken.
You're not broken, you're adapting.
Will I ever enjoy food again?
You will. Taste isn't gone, it's shifting.
So this isn't punishment?
It's protection. Your body is asking for kindness.
I never thought of it that way.
Health isn't a cage, it's a path.
I want to walk that path without resentment.
Then let's make food your ally, not your enemy.
I'm ready to try.
That's the beginning of freedom. Cardiologist explains heart tests.
You ordered so many heart tests, and I feel like something must be horribly wrong.
Tests aren't panic, they're information.
But what if they find something?
Then we treat it before it becomes something worse.
I don't want machines telling me my fate.
Machines don't tell fate, they reveal opportunities.
I didn't expect heart health to be so complicated.
The heart carries emotions and blood. It deserves attention.
I thought mine was strong.
Strength isn't absence of problems, it's facing them.
Will these tests hurt?
No, they only listen to your heart's story.
I'm scared of what it might say.
Stories aren't endings, they're beginnings.
So this is a start, not a verdict.
Exactly. You're choosing a future, not fearing it.
Saying goodbye after long-term treatment.
It feels strange leaving today. This hospital has been my second home for months.
Healing places often feel like homes because they see our truth.
I'm happy to go, but terrified to live without daily help.
Help doesn't vanish. It changes shape.
You've seen me at my worst.
And your worst never took away your worth.
I'm afraid I'll fall apart again.
Falling apart isn't failure. It's part of rebuilding.
I don't know how to thank you.
You thanked us every time you tried again.
Will you remember me?
People who fight for life are unforgettable.
I want to live, not just survive.
Then go write a life that matches that desire.
I'm scared, but excited.
That mix means you're alive.
Goodbye. And thank you for everything.
Goodbye. You healed more than you realized.